Welcome to Stat, I'm telling you all medical true crime stories, and it gets bizarre. Karen Wickham, yeah, she used to work in ER, and now she's sharing the knowledge, so let's get involved. Hey, funny and scary at the same time. Medical mysteries, all facts, she ain't lying. So tune in to Stat if you dare, cause crazy things can happen anytime, anywhere. Yeah.
Hello, everybody out there in podcast land. Welcome to Stat, Shocking Traumas and Treatments, and I am your host, Karen Wickham, coming to you from beautiful Toronto, Ontario, Canada. Hello, everybody.
Hey, everybody.
It has been a little while.
It has.
Yes. Went through surgery and then post-surgical infection that landed me back in the hospital for another 4 days.
Mm-hmm.
Actually, the first surgery, I went home the same day.
Yeah.
And then I ended up back.
It was.
Had some pelvic surgery and had to have a suprapubic catheter. So I could, it's a catheter that goes in through the outside of your body into your bladder, just above the pubis, so that you can pee from there, because other areas maybe aren't in the right condition to do that.
They're in recovery mode.
But what happened is that the area of the catheter got infected, had cellulitis, and then a massive bladder infection that was leading me into sepsis. My blood pressure had bottomed out, and my vitals were all whacked out, and my blood work. So, yeah, it
was scary.
And I'm like, I had taken such good care of that damn thing, and I was like, what the hell? And then my doctor said it likely happened, got contaminated in surgery, because sometimes it can happen, no matter how clean. And I really respected her for that, because a lot of doctors be like, well, but she's like, hey, it happens and I'm sorry. And anyway, I got amazing care, and I am very close to, I'm on the mend now and feeling a lot better. But for the longest time, I was just too exhausted. My mind was too mushy.
Yeah. Well, your body was in recovery mode.
Yeah. I was really, Mary was like, uh-oh.
Well, I think anytime you have, something going from, the outside of your body, like where it's touching air, into the internal part of the body, like an organ, there's always, a risk for infection. And I was surprised too, because I was like, why is it just like there? There's nothing taping it in place.
I talked to the doctor, and she said that they don't usually put gauze around it or anything, and it's pretty rare that people get infections from it. But I went home with pain that day, right in that left lower quadrant, and I thought, this is just part of the surgery. And then the next day it really hurt, and then within a week, by the third, fourth day, I was in excruciating pain. I'm like, all right, hopefully this will get better, maybe this is part of it. And then I hit high fever, and then in the car it was like 39.9, it was pushing 40.
It was bad. It's like 4:30 in the morning. Okay, we're going to Mount Sinai.
And I'm like, I'm not feeling so good. Anyway, that was why. And this is why I've been off. And then poor Mary got sick as a dog for a week.
Oh, my God.
And here I am, hobbling around, trying to...
like Norwalk 2.0 or something. I don't know what the hell it
poor
was.
Poor girl. So, yeah, we both got nailed.
Yeah.
Over the last month, it's been rough.
Sickies taking care of sickies.
Yeah, sickies taking care of sickies, exactly. So now we're back and feeling so much better. And now 60, that you've heard...
40, 65, 35.
Yeah. You've heard our tales of woe. And on that, we're going to talk about some more women's health issues. Mm-hmm. And we are on the ovarians. Mm-hmm. I've decided to change the name of certain things. Mm-hmm. From now on, anus is anus. And the vagina is the vagine. Mm-hmm. I had another one. I forget what it was. Anyway.
Something about the perineum. I can't remember. Or Erica's favorite, the taint.
I say to my doctor, taint hurts. You'd probably know my doctor's awesome. Anyway, okay, so let's This is going to be the last of the Women's Health series for now. I'm going to do some more in the future about pregnancy and issues around pregnancy, postpartum depression, and postpartum psychosis, and touch on those. But I want to do those separately from this because I want to make it sort of a little series on its own and talk about some stories around that. I've already touched on like the Andrea Yates case, which was an extreme, a horrible situation that happened there. But so, yeah, that'll be a little bit into the future. But so let's just get started now that I've talked about that. Okay, ovarian cysts. I have had ovarian cysts. They're not fun. And it's a pretty common thing that happens to women. Mm-hmm. And I'm going to start off with a little biology 101.
All right, sounds good.
Because I know it's not just women that are listening to this. It's men as well. So this is, let's just do it. Biology 101. Fluid-filled sacs or pockets in an ovary or on its surface. And each ovary is the shape of an almond on each side of the uterus. Eggs, otherwise known as ova, develop and mature in the ovaries and are released in monthly cycles during childbearing years. Many women have cysts at some point in their life, and most present little or no discomfort and are harmless. The majority resolve themselves without treatment within a few months. But sometimes they can rupture, and that can be very serious. I will get into that.
Little bastards.
Yeah. Symptoms: pelvic pain, dull or sharp ache in the lower abdomen on whatever side the cyst is on, fullness or heaviness in the abdomen, bloating, and you need to see your doctor immediately if you get a sudden severe abdominal or pelvic pain, pain with fever or vomiting, and then you may be in shock if you have cold, clammy skin, rapid breathing, lightheadedness, and weakness. And that is key to what I just said about rupture, because if a cyst has ruptured, you could be bleeding internally. And the same with, depending the size of the the size of the cyst equates to the amount of bleeding that can happen and how fast. And also what can happen is an ovarian torsion. And the cyst can be so large that it pushes the ovary out of place and it twists. And that is extremely painful. And what it does, it will cut off the blood flow to the ovary and causing necrosis. Mm-hmm. So
just like if a guy gets a testicular torsion.
Exactly, it's the same. Ours happens on the inside. Okay, the causes. Most ovarian cysts develop as a result of the menstrual cycle. And there are different types of them. So the first one is called a functional cyst. The ovaries normally grow cyst-like structures called follicles each month. Follicles produce the hormones estrogen and progesterone, and they release an egg when you ovulate. If a normal monthly follicle keeps growing, okay, you can have two types of these functional cysts. The first type is called a follicular cyst. So around the midpoint of the menstrual cycle, an egg bursts out of its follicle and travels down the fallopian tube. And this cyst begins when the follicle doesn't rupture or release the egg and continues to grow. Okay, so the fluid just keeps,
it just doesn't hatch
growing.
Exactly.
Yes, exactly it. And the next type of functional cyst is called a corpus luteum cyst. The follicle releases its egg and it begins to produce estrogen and progesterone for conception. And the follicle is now called a corpus luteum. And sometimes the fluid accumulates inside the follicle, causing the corpus luteum to grow into a cyst. These kind of cysts are usually harmless, rarely cause pain, and often resolve within 2 or 3 periods. Now, the next type of cyst scares the hell out of me.
I think I've seen pictures of these.
It's that of horror movies.
Right.
It's called the dermoid cyst.
Yes.
Teratomas. They can contain tissue such as hair, skin, or teeth
Yeah.
because they form from embryonic cells. And they're rarely cancerous. But if I felt that there was something inside of me that had teeth, hair, I honestly, it really messes with my head. I have a hard time thinking of it.
It's an alien.
It's not even an alien. It's just, oh God, I don't even want to think about it. Let's move on.
Just Google the teratoma, whatever. What the heck they call it?
Oh God.
Just Google them.
Oh God.
So gross.
The next is a cystonoma. And they develop on the surface of an ovary and might be filled with a watery or a mucus type material. The next are endometriomas. And these are very painful because some of that tissue attaches to the ovary and it forms a growth. Dermoid cysts and cystonomas can become large, causing the ovary to move out of position like we talked about before, and that increases the chance of torsion. Risk factors: hormonal problems, including taking the fertility drug Clomid, causes ovulation. Pregnancy: the cyst can stay on the ovary during pregnancy. Endometriosis: the endometrial cells can attach to the ovary and form a growth. Severe pelvic pain spreads to the ovaries and cause cysts. And then previous ovarian cysts. So all of these things can lead to having more ovarian cysts. Complications, like we talked about, torsion and rupture. And vigorous activity and intercourse can actually increase the risk as well.
Of what? Of them rupturing?
Yes.
Okay.
Diagnosis. So it can be found on a pelvic exam, depending on the size, and whether it's fluid-filled, solid, or mixed. Tests. So some doctors will do a pregnancy test because a positive test might suggest that you have a corpus luteum cyst. Pelvic ultrasound, and our favorite, the transvaginal, in which the wand actually is inserted to the vagina and they take a look around with that, and that is never fun. And that will show the presence of a cyst, its location, its size, and whether it's solid, fluid-filled, or mixed. You can have a laparoscopy, depending on what the size is. They want to take a really good look at it even more, and they may actually remove the ovary if it's bad enough or they see something really concerning.
Mm-hmm. My favorite word, oophorectomy.
Oophorectomy. And of course, that's a surgical procedure. And the next is a blood test, CA125 blood test. And this is done because blood levels of protein called cancer antigen 125 or CA125, they can be elevated with ovarian cancer. So they want to rule that out. But they can also be elevated with non-cancerous conditions like pelvic inflammatory disease, uterine fibroids, and endometriosis. And they really, really want to do this blood test to rule out cancer to begin with, especially if it's a solid cyst. Next, treatment. Watchful waiting. So have follow-up exams and see how everything's going. If it's looking like it's a fluid-filled cyst, something not to be concerned about, they'll keep an eye on it. Medication, some people go on hormonal contraceptives, and that helps reduce the risk of cysts, but it won't shrink one that's already in existence. And of course, there's surgery, removing it if the cyst is too large, and it keeps growing, and it won't resolve, and it's extremely painful. So it's in extreme cases that they will remove the actual ovary, but surgery is a possibility. And then, of course...
Yeah, I would assume that's kind of a last option.
Oh, it totally is, yeah. And then, of course, if it's cancerous, they will 100% remove it and then lead to radiation and chemo. And we're going to talk about ovarian cancer in this episode. Okay. Next, let's move on to polycystic ovarian syndrome. also known as PCOS. It's a hormonal disorder common among women of reproductive age, and it causes infrequent or prolonged periods. Oftentimes, there's an excess in the male hormone androgen, and the ovaries may develop numerous small collections of fluids in the follicles and fail to regularly release eggs. So here are the symptoms. These symptoms often develop around the time of the first menstrual period during puberty. And sometimes it develops later in response to a large amount of weight gain. So they have associated a large amount of weight gain with PCOS. The signs and symptoms may vary, but if a woman has at least 2 of these symptoms, it's likely that she has PCOS, or they will do investigation into it. So 1, irregular periods. Infrequent or prolonged cycles are most common. If a woman has fewer than 9 periods per year or more than 35 days between periods and they're abnormally heavy. Excess androgen. So elevated levels of the male hormone increases facial hair and body hair, occasionally severe acne, and male pattern baldness. Next is polycystic ovaries. The ovaries may be enlarged and contain follicles that surround the eggs, and they might fail to function regularly and would be more severe if very overweight. They don't really know what causes it, but they feel that the following things play a role in it. So one of them is excess insulin. The increase of insulin may cause an increase of androgen production, causing difficulty with ovulation. And some women have a low-grade inflammation process going on. They're not quite sure why. So is this the cause or the symptom of PCOS? But the woman may have an increased production of white blood cells and the substances from that to fight infection. So it's actually, fighting against the body. And women with PCOS have a type of low-grade inflammation that stimulates the polycystic ovaries to produce androgens that also can lead to heart and blood vessel problems. So one is affecting the other. It may be hereditary. Again, the excess of androgen, and then why is there an excess of androgen? Complications: infertility, gestational diabetes, preeclampsia, miscarriage, premature birth, non-alcoholic steatohepatitis, which is severe inflammation of the liver with the accumulation of fat. But it's not caused from drinking. It's just unknown cause. Metabolic syndrome, which is a cluster of conditions like high blood pressure, increased blood sugar, abnormally high cholesterol and triglycerides, and with that, an increase of heart disease. Type 2 diabetes, sleep apnea, depression, anxiety, or eating disorders, abnormal uterine bleeding, and endometrial cancer. So this is an extremely serious syndrome for women.
Yeah, I don't think there's enough it's not talked about enough, I don't think.
Yeah, and I want to touch on something after we go through this.
Well, I know some clients and they just kind of suffer with it, but it doesn't seem like anyone knows how to fix it. I mean, obviously there's some sort of hormonal, endocrine, metabolic origin, possibly.
That's the thing, possibly. I want to touch on something after.
Okay.
So how do you diagnose it? There is no definitive test to diagnose PCOS. So, like we talked about before, if you have 2 or more of these symptoms, then we think you have it. So medical history: what are your menstrual periods like? Have you had weight changes? Physical exam, that includes pelvic exams and blood tests to test for the different hormone levels, glucose tolerance, and fasting cholesterol and triglycerides. Ultrasound and transvaginal ultrasound to check the appearance of the ovaries and the thickness of the uterus. And then other tests are ongoing, like you're testing your blood pressure, your glucose, cholesterol, and triglycerides. Also screening for depression and anxiety and for sleep apnea. So what's the treatment? The treatment is to manage the symptoms. So lifestyle changes, weight management, exercise, medications. One of the things that is often prescribed is a combination birth control, pills or patch. So estrogen and progesterone is given to decrease androgen production and regulate estrogen. Regulating hormones can lower the risk of endometrial cancer and correct abnormal bleeding and excess hair growth and acne. There is progesterone therapy, which regulates the periods and protects against endometrial cancer. And then there are a few other medications that help with ovulation and then can help with pregnancy, because it's difficult for some women, obviously, to become pregnant with PCOS. So there's gonadotropins, there's letrozole, which is used actually for breast cancer, but it can, in small doses, stimulate the ovaries. Clomiphene is an anti-estrogen medication taken during the first part of the cycle. And if that's not working, sometimes they'll use metformin with it, which is, used to lower blood sugar. And if you don't get pregnant while using clomiphene, they may give you the metformin so that they can work together to help become pregnant. And then there's a drug called Vaniqua, so that can help with slow facial hair growth in women, healthy lifestyle. And so that's PCOS. So this is where I want to talk about something here. Women's symptoms are often overlooked. If you go to a gynecologist, that's not usually a problem. But when some women go to their family doctor, and some don't have family doctors because of the healthcare system, they may have to go to a walk-in clinic to get treatment get tests done. And right off the bat, they're told, oh, you're overweight, lose weight. That's the reason why they're unwell. Often goes straight to, you're overweight. Oh, and you're depressed? Well, that's not surprising because you're overweight and you're unhealthy. So much of women's, we have real health issues, but often it goes straight to weight and mental health. And so many other things are overlooked because they go straight for that. We need to be as healthy as possible. But how many things are misdiagnosed because they go straight for that? Mm-hmm. And it makes me crazy. Mm-hmm. PCOS is it's a serious syndrome.
Well, it's like blame almost, It's
of course it's blame.
It's because of these things, and if you just did that, you'd be better. And it's like, no, there's real reasons that women have these issues.
This has been going on with women's health forever. I look back, we look back at the 50s and 60s, Mother's Little Helper, Valium, mm-hmm. and Speed. Mm-hmm. So she's depressed. Give her Valium. She's hysterical. What? 'Cause she's actually showing emotions. Give her Valium. She doesn't have a lot of energy. Give her Speed. Mm-hmm. So there's women, tripping out on, 8 balls, medically prescribed 8 balls, because they're not doing the womanly things right. It's always in the head. It's always in between the ears, and so that's not happening because we had a whole generation of women that were become addicts. They had no idea that these drugs were doing what they were doing. Oh, I feel better. Okay, good. But still, maybe we're not making women addicts, so to speak, by prescribing those drugs. But it's still, oh, you're fat? That's your problem. So that's my little rant right now, because women have So you look at PCOS. What are the risks here? Diabetes, high blood pressure, cardiovascular disease, depression, pain, infertility, right?
Yeah.
This has to be taken seriously, and these tests have to be done. Let's move forward onto primary ovarian insufficiency. What happens is the ovaries stop functioning before the age of 40. And the ovaries don't produce typical amounts of the hormone estrogen or release an egg regularly. It was once known as premature ovarian failure. And of course, this often leads to infertility. Sometimes it's confused with premature menopause. So like anything, other things need to be ruled out first. Symptoms: irregular, skip periods. This might happen for years. And this can develop after pregnancy or after stopping birth control. Again, so many women suck it up. Oh, I've always had horrible pain with my period. Oh, I skip it all the time. You know, like you said before, I know we've discussed this in another episode. No woman should have to take Percocet to get through a period, be flat on their back with hot water bottles and, Advil and Tylenol at their side just to make it through a period every month. So the other symptoms are difficulty getting pregnant, and hot flashes, night sweats, vaginal dryness, dry eyes, irritability or difficulty concentrating, and decreased sexual desire. So you can see how it can be mistaken for early onset menopause, but everything, you got to look at everything. So the causes, they're not exactly sure what the causes are, but there are some chromosome changes or genetic disorders that can lead to it. And two of them are Turner syndrome, and the other is Fragile X syndrome. But these are very serious medical conditions that you would know that you would have from birth. Another cause may be from toxins, chemotherapy or radiation therapy, cigarette smoking, chemicals they may have come in contact with, pesticides, and even a virus can damage the genetic material in cells and hasten ovarian failure. Another cause can be autoimmune diseases. It's rare, but the immune system produces antibodies against the ovarian tissue. It can happen. It harms the egg-containing follicles and it damages the egg. They're not sure what causes the immune response, but it could be a possible exposure to a virus. So what are the risk factors? Age. There's an increased risk between the ages of 35 and 40, but it can happen in younger women, including teens. Family history and ovarian surgery. Complications are infertility, osteoporosis because of the decrease in estrogen, depression and anxiety because of low estrogen, and heart disease because of the early loss of estrogen. So it's the estrogen. Like you can see how low estrogen really, really affects the system as a whole.
Yeah, it's the same with older men and low testosterone. It's a huge impact on their health.
Diagnosis. They want to do a pregnancy test to check for an unexpected pregnancy or to try to figure out like why there would be a missed period. Does it have to be because you're pregnant or is it something else? The next thing they'll check is hormone levels, one of them being FSH, which is your follicle stimulating hormone. And then the next, I don't know if I'm going to say this right or not, but I'm going to try estradiol, which is a type of estrogen. They want to check the level of that. They check your prolactin levels. Prolactin stimulates breast milk, so it's another thing like what's happening. Are the hormones too high or too low? What levels are they at? And then they check for chromosome changes like the genes associated with Fragile X syndrome. Treatment: estrogen therapy, calcium and vitamin D supplements, which help prevent osteoporosis if your estrogen is low. Then there's also the discussion of infertility options. just to cover everything. Okay, the next is ovarian cancer. As we know, your mom, we discussed it, your mom passed with that. So, our rest in peace, Mama.
Yeah. It's been tough.
Yeah. Sorry.
It's okay. It's just, there's been a lot to process, and I think, the pandemic on top of it really, I guess, who knows how long this was occurring in my mom. It could have started before the pandemic, but I just feel like not being able to access healthcare, could something have been, found out sooner?
She fell between the cracks. A lot of people have during this pandemic. I mean, I'm not taking away from your mom, but think about all the thousands and thousands of people that couldn't have access to their doctors, that, got very sick because their diabetes was out of control, or heart failure, or cancers.
Came back. Yeah, I've heard of those too. And, it's just disappointing to me now still, even though that we've opened things up more, but family doctors, some of them still aren't seeing people in person here in Canada. And that needs to change, because the ERs are overwhelmed. Our wonderful ER doctors and nurses and staff are overwhelmed. And, if I'm massaging people throughout this whole time wearing a mask, like, how is it that they can't see a person in person?
Yeah, and I hope this doesn't become like, what's the word I'm looking for? Like
the new normal?
Yeah. Because
you can't diagnose
we already had a
people.
problem with access to healthcare because our system is already overwhelmed. Like we said, there's so many people that don't even have family doctors. We lucked out. But I think, you know what, now that we're talking about it, I'm gonna write to the clinic and just say, when are you going to change this? And maybe if enough of us do that, they'll...
Well, and I think, too, encouraging people... I was thinking of writing to the MP for our riding. I mean, maybe after the election, because I'll wait until see who is going to be elected. But
no, threaten them. You want to be elected? You got to change this. But
oh, yeah, that's true,
yeah,
too.
Yeah. It's just,
Yeah, so
brutal.
it's been tough. And, I think there was stuff initially that was misdiagnosed because some of the symptoms, as you'll describe, are misleading, especially in older women.
Exactly. And maybe many of these tests could have been done to rule out. So let's talk about those symptoms. So in the early stages, there may not be any symptoms, and they can be associated with other conditions like GI conditions, like constipation, irritable bowel, those types of things. You get abdominal bloating and swelling. Again, you're constipated. Of course, you're going to get bloated, right?
Or irritable bowel.
Yeah.
That was a common, for a couple of years. We were actually more concerned about colon cancer because there's a history of colon cancer.
Yeah.
My mom's dad died from it, and there's Crohn's and whatever. So my mom was having these episodes of, I would say, more irritable bowel. She was very regular, so to speak. So it was uncommon for her to get constipated. Very uncommon. So, but towards the end stage, she did get more constipated. She was taking some Restorelax and stuff.
And then they say, okay, well, because you're not able to go out and do things and you're not exercising as much, and that can lead to it. And and then quickly feeling full when eating. Again, if you're having bowel problems, that could be it.
That was a big one in the...
Weight loss, discomfort in pelvic area, fatigue, back pain. We just said changes in bowel habits and urinary frequency. The causes are unclear, but they have identified the risk factors. So it can be caused by changes and mutations in the DNA. And these changes tell the cells to grow and multiply quickly, creating a mass of cancer cells. And then they replace the healthy cells. There are different types of ovarian cancer. One is epithelial ovarian cancer, which is the most common. And then there are subtypes to that, which is your serous carcinoma and the mucinous carcinoma. The next is stromal tumors. They're very rare, and they're usually diagnosed at the early stage, other than other ovarian cancers. There are germ cell tumors, which are also rare, but are diagnosed when women are much younger. The risk factors are being older. The risk goes up the older you get. And so ovarian cancer is most often diagnosed in older adults and the elderly. Inherited gene changes. So there are genes that you inherit from your parents that carry sort of the gene for ovarian cancer, and it's the BRCA1 and the BRCA2. And they also increase the risk of breast cancer as well. The next is also something called Lynch Syndrome, which I had never heard of before. It is an inherited condition that increases your risk of colon cancer, endometrial cancer, ovarian cancer, and other cancers. Family history of ovarian cancer, being overweight, postmenopausal replacement therapy like your estrogen, progesterone, endometriosis that attaches to the ovaries, age when menstruation starts and ends, and never being pregnant. Prevention, there is really no known, I don't want to say cure, but there's nothing really that, that can be done that they, to reduce the risk other than, the things that were just listed above.
Mm-hmm. My mom did do HRT. She did do hormone replacement therapy for a number of years when she first hit menopause, and she was just, unbearable night sweats and whatever and stuff. So, but back then they didn't realize that was, a risk factor. And so... Yeah,
maybe that was something that led to it as well.
So it's definitely, being that it's a risk factor, my mom did do that. It's possible that it could have contributed to that. So
yeah, for prevention, that also birth control is given as a prevention, and genetic counseling. Go in and see. I mean, that might be a good thing for you and your sisters to do. Go in and maybe get some blood work done to see if you carry any of these genetic materials, and it gives you something to be more aware and to look out for. And it's diagnosis. It's through different types of things here, like pelvic exam, imaging, like ultrasound and CT scan, blood tests. I talked before about the CA-125, surgery, the genetic testing I talked about. So those are often, those are how you can diagnose it. And then, of course, there's the staging 1 through 4, 1 being that it's confined to the ovaries, then different stages of spreading to number 4, which it's metastasized to different areas or distant areas of the body. At this point, there's surgery to remove the ovary and maybe its fallopian tube, and then if it's more progressed, to remove the ovaries and the fallopian tubes. Next, to remove the ovaries, fallopian tubes, uterus, and nearby lymph nodes, and the fold of fatty tissue in the abdomen called the omentum. And then the 4th is surgery for the advanced cancer to remove as much of the cancer as possible. With this comes chemotherapy, targeted therapy, which they focus on a specific weakness present within the cancer cells, hormone therapy that blocks the effects of estrogen on the ovarian cells, and immunotherapy. It uses the immune system to fight cancer. The body's disease-fighting immune system may not attack cancer cells because they produce proteins that help them hide from the immune system cells. And the immunotherapy works by interfering with that process. And then next is supportive care, palliative care, and coping and support. So that's the episode for today, covering the ovary. We touched on how women's health is too often disregarded or chalked up to appearance, weight, and mental health. And I know there's something that you just want to that's important for you to say right now. So
I just want to say that, there were times, of course, it was difficult during a pandemic to sort of, as my mom being an older person was just like, she put stuff down to being older. Oh, I'm tired. It must have been something I ate. But I guess I just wish that there had been more of a push from us. But I don't know. This could have been going on for a year and a half before. When it was finally diagnosed, my mom was already quite advanced, and she only she went into palliative care about 2-3 weeks after her diagnosis, and then she lasted a month. I just want to give a big shout out to Innisfree House in Kitchener, the hospice that my mom stayed at. All the staff, everybody there is amazing, and my mom had actually volunteered there for many years, so it was wonderful that they could take care of her in her final days. But I just want to encourage you all who have older moms out there to not dismiss things when, if someone who's normally a fairly healthy and energetic person is tired all the time or having symptoms that seem, out of the norm for them, just encouraged to get it checked out, because, there was stuff that was happening with my mom that was, it's her heart. That's why she's got, shortness of breath or fluid retention in her abdomen. But, by the time they finally got to it, it looked like she was, 7 and 8 months pregnant. And this was the fluid buildup from the ovarian cancer invading into the abdomen and the fat layer in the abdomen. So
the omentum.
Yeah. So I'm just encouraging you all from my experiences, just, don't let your parents just dismiss, it's old age or whatever.
Your mom was very stoic as well. Like a lot of elderly people, especially from their generation, they just suck it up, right?
They do, but there's a lot of stuff that maybe it should be looked at. There's a lot of stuff that should be looked into. That's not to be dismissed. Just because someone's older doesn't mean they should suffer with pain or be tired all the time or have these issues and just chalk it up to getting older. Because I know a lot of older people who are quite healthy. And so, when there is a change in their health like that, I encourage you to support your parents or your loved ones that are older and, get things checked out. A simple blood test could save someone, just a simple blood test could verify whether there's something more serious going on. So,
and also if we're getting up in there in age, that we don't dismiss our own symptoms as well.
Yeah.
But everything you just said there was so bang on. I mean, thank you for sharing how you feel, and thank you for those suggestions, things to think of. I think like I said, you're absolutely bang on with that. And again, I'm sorry. Your mom was awesome.
Thanks. It's for you, Mom. I love you. Miss you.
Okay, on that note, I just want to thank all of you for listening and for hanging in over the little hiatus we took here. And I want to thank Lynn McDonald for becoming our newest Patreon supporter. Thank you, Lynn.
Thank you, Lynn.
And thank you for everybody that continues to support us through Patreon, and all of you that listen and participate in the Facebook page. We've got the best listeners in the land, and we love you guys. Thank you for that.
Thanks.
And on that note, remember to take care of yourselves, take care of each other, love each other, but most importantly, love yourself. Peace.
One love.
True crime and it gets none realer. Sometimes it'll be the cure that'll kill ya. Gotta watch out, yeah, you gotta watch your back, cause you don't wanna be another episode on Stat. Thank you for tuning in, learn a thing or two. These medical mysteries can be unbelievable, yeah. Subscribe, make sure you do that so you'll be tuned in and be ready for the next show. Stat.